Hello there, thank you for returning to the clinic. You recently saw some new equipment and today I'm going to be testing it out on you, performing various medical tests. It promises to be very relaxing. I'm also going to be recording all results in the electronic files here. So let's just put the date and your name. Oh, by the way, happy Valentine's Day. Right, let's get straight to it now then. Notice you've brought your specs in as requested for adjustment. First thing I notice, this side is perfect. This one is very floppy. I think you have a screw loose. Let's see if I have the right equipment for the job. I'm trying not to stab myself. That's a little bit better. Anyway, you recently saw the lens cloth, so I want to see how this one performs. Does it do the job? Actually having a bit of a brighter day here in the UK. Been really gloomy recently, hasn't it? It's been raining non-stop. Yep, it's a good job, so I will leave your sunglasses there for you. So well done to the R&IB cloth there. Right arm tightened, lenses cleaned, R&IB cloth. Okay, so one of the items you saw was the pen torch. Great little things. You can perform multiple tests. You have to be careful. Sometimes these cheap little shitty pen torches can flicker rather quickly. And the bulb can go. Looks as though we have good power. So just looking at the wall, please, to check your direct responses. Okay, and the right eye consensual. And the left consensual. What we call the swinging flashlight test. I don't think you've had any recent neurological problems, have you? No optic neuritis, retinal detachments. Glad to hear it. Okay, so follow the light this time with your eyes. Just going to have to ignore the flickering. I did say that these aren't the best pen torches in the world. They mass produce them with probably inferior parts. Looking into the light, please. I'm about to throw this at the wall. That's the reflexes. reflexes. Okay, and I want you to look towards my left eye. I'm going to check the openness of the anterior angle there of the eye. In fact, look towards this eye now. Let's record those results down because we're going to use the pen torch for a little bit more. That was the ocular section. Negative RAPD. Ocular motility. Did you notice any double vision of the light? Excellent. Now diplopia. And then we perform the anterior angle assessment. Grade 3. Right and left, and corneal reflexes. Moving on. We're going to use the light in conjunction with the tongue depressor to have a look inside your mouth now. Let's look at the throat, the tongue, and the hard and soft tissue. Okay, so open wide, please. Right. Just raise the tongue to the roof of the mouth now. And now open wide again, tongue flat, please. Right, say ah. And again. And once more. Okay, keep the tongue flat, please. Open wide again. Right, just tilt the head back slightly, tongue flat. I can't see any inflammation or lesions. Okay, let's have a look at the teeth now. So, open wide again, please. Okay, just push the teeth together, please. Stick your tongue out. Tongue to the right. The tongue to the left. Excellent. Right, I'll see if I can think of any more tests with the pen torch, but for now, I think that's everything. Oral examination. I'm going to advise scrape and polish with your dentist though. Other than that, a little bit of tartar. That's about as far as things went, so not too bad. Right, we did have some new occluders, so just look into the distance. I performed the cover test. This is the Spa Medica occluder. We said we had a scale, so just look towards this eye, please. And my left eye. Left eye again, please. And right eye. I'm going to get you to look towards my finger. Let's do the near cover test here, please. And with the second occluder, remember we have a pupil size measuring scale there, so just look straight towards me, please. Try and get these measurements. We're looking at around a 6mm pupil size there, so not bad for relatively bright conditions. We said we had good constrictions. We did cover test distance. May have been around 2 to 4 diopters. Prism diopters for exophoria. Near, would estimate 6 to 7 prism diopters. Exophoria. Ocular measurements. Iris diameter. Pupil sizes. Excellent. We also had the rotating near vision chart. So let's have a little look. Now I'll hold this at this distance. Can you read the text for me, please? I'll do this with both eyes open. I want you to have a read as far as you can down the chart there, please, saying the letters. Good work. You'll see a box of letters here. I want you to pick one row horizontally and read the letters in that particular row, if possible. I know it's a little bit difficult, that one. That's okay. Okay, can you read that vertical sentence there? Excellent. that's it for that one, thank you. What else do we have? Contrast time now, so we have a number wheel, sort of like the face of a clock. Start at 1, work your way around the wheel and tell me which shape you see next to each number, please. I'm going to hold this rather close. There we go, so 1, triangle, excellent. 2 cross, 3 square. Just continue, please. So I'm going to give you some extra time on this one. I'll bring it a little bit closer there. I'm going to keep pushing. Excellent. Not the easiest test. Contrast sensitivity. That falls into a good category, so well done. Right, we'll do a quick binocular visual field test. In the centre of this grid you will see a cross. It's important that you keep looking at the cross, and then I'm going to point to a picture somewhere in the periphery, and then I want you to say what you think that picture is. But it's very important you keep looking at the cross. If you look away from that, we'll have to abandon the test. Alright? So, looking at the cross, I'll try and hold this still. Try that picture there. This one, good. And there. Just above my index there, good. There we go, it's quite fitting for today. What about the one above there? And the one there. Good, keep looking at the cross. And this picture here. Marvellous, thank you. So we're not going to go into too much detail on that. Right, we're going to do some reflexes with the Taylor hammer here. Check everything's in order, lovely. I want you to just hold your arms out here, please, as it won't hurt. Well done. Lovely. And your left arm there, keep it there please. the hand. And just once again the elbow. Excellent. All intact. I think it's important that we move on to some slit lamp checks now. On the machine just over my right shoulder. You can certainly utilise the new equipment to make it a thorough and tingly experience. But first, these hadn't arrived previously, but we have some new bulbs for the slit lamp. I just want to change the current bulb, see if we can get a little bit more brightness, alright? In theory, that should just slide out. There we go, it's intricate work. I believe this is a 12 volt, 35 watt bulb. I'm placing it there, you can see the filaments. Let's have a look. Well, I just need to test it out now. Marvellous, fingers crossed. So chin on the chin rest and head flat against the top, please. I'll be worth just blocking one eye there to keep your fellow eye straight. I'm going to be focusing on blepharitis today, and then we'll perform some fundoscopy with the Occluders, so please. Just try and look this area just behind the occluder, please. You're going to hear some clicking sounds. Just relax. If it's too bright, just let me know. I just want you to look up to the ceiling. And now if you could look down to the floor. Lovely. Okay, keep looking the same direction here. I just want to perform a optical section of the cornea. Excellent work. Right, let's utilise the power of the 60 diopter Occluders to have a look at your optic nerve and macula. I'm going to hold the lens just in front of the eye. There we go. I'll just come in there, lovely. Go a little bit brighter with this. Okay, just look the same direction, please. So the margins are distinct. The optic nerve has a very bright pink appearance. And just to the side I can visualise the macula. Now I have seen dome-shaped maculopathy before, but your macula is very flat. Nice reflex. Indicates good health. Lovely. Just checking the mid-peripheral zones there. Right, if you can kind of look behind this occluder, somewhere in the centre, I'm going to review your left eye. That just rotates the beam from vertical to horizontal. Just look up to the ceiling again, please. Just look down to the floor. And just a quick scan of the cornea, but detailed. Right, so I'm just going to review the situation, and certainly no grade 2 blepharitis. I think there's a little bit of grade 1 occurring, so I may have to recommend some warmer compress therapy. The corneas are fine. I'm going to see if I can look at the back of the other eye with the Volk lens. That's it. Again, just looking straight in the same direction. I do need about 80 to 90% brightness there. Again, that's pink and defined, a little bit of a choroidal crescent. Nasally. Checking the cup. And an estimation of the neural retinal rim, thank you. it looking straight. Checking the mid-peripheral zones there, and the red free. Excellent. So the front of the eyes, the external health is not too bad. It's more the lids and lashes and cornea today, but secondary findings, nothing jumped out. And I was quite happy with the fundus and the key landmarks located there. So I'm going to let you go now. Remember, I said see your dentist for a scrape and polish. Thanks for coming in, and I will see you in about a year's time.